When I think of HIV testing, I think safety and knowing for sure that everything's good.
When you say the words HIV testing to me, the words easy, the words convenient, and weirdly enough, the words fun occur to me.
I actually get excited. No, it's true. It's like going into a sexual health check every 3 months and you sit it down by your wonderful jolly nurse, June.
I know everybody at the sexual health clinic when I go and visit. I know the nurses by name.
Judy will say, "Come on, Chris, open up for me," and I'll say, "Oh, I should be so good at this. Oh."
The first thing that pops into my head is just going to a doctor's clinic and then, waiting for the text to tell you that the results are in. It's pretty straightforward and not intimidating. It's a kind of routine thing for me now.
If you're having regular sex, which most people are, I'm sure, then I think every 3 months, I get tested every 3 months. I just like to be sure.
I get tested every 3 months, regardless of what the sexual practice was. I mean, if I've just given head in the past 3 months, I'll still get myself tested.
I haven't had sex for the last half year, so I didn't get tested.
I think the worst feeling about getting that test is thinking that something might come positive.
I find as I'm driving to the clinic, I reflect on my behaviour, what I've done, who I've done it with, etc. And should I have any reason to find out something I wouldn't already know.
When you're about to receive the results of the HIV test, I think it is quite a nerve-wracking process. There's always that chance that you might receive a result that you don't want, so it does get quite scary.
But living in that kind of limbo of like, oh, you might be at risk but not quite know where you're at is probably a lot worse than, going and getting tested.
I remember the first time I got my result and all negative. And I even posted on Facebook and said, "Oh yes, all negative." And my friends are so weird.
I suppose the best thing about the HIV test is just knowing that you're safe and knowing that it's, the results are either positive or negative, having some definite course of action.
I think the earlier you get tested, if it's negative, that's awesome. But if it's positive, it will be a lot more chances to get earlier treatment.
Well, a rapid HIV test is you go to a clinic, get your little bit of blood out, get tested, and you get the results within half an hour.
I had my rapid HIV test at a queer event that I was hosting. The nurse came on stage and pricked my finger and, "See guys, it's all that easy."
I have had a rapid HIV test. Just to know straight away is such a burden lift off.
And they don't necessarily have to be definite results. You obviously want to get tested within an appropriate amount of time, but it's something that you can do nice and easy and quickly, particularly if you're concerned that you might have been exposed.